Hello, my name is Adam. I will be demonstrating drawing blood from a central line. So before I enter my patient's room, I'm going to look at my order, which here I have an order to do a lab draw for a CBC, complete blood count, and a basic metabolic panel, BMP. And I'm looking here to make sure that I have the right patient. Jennifer Doe, date of birth 11/5/1975, no known allergies. Lab draw. Okay, also gathering my supplies. This is what I'm going to be using. I have 3 saline flushes, and I checked the expiration dates on here, which they are 4 of 2020, and 4 of 2020, and 4 of 2020 on here. Some facilities require a heparin injection as well. I'll check the expiration on this heparin, which is 4 of 2020. Okay, so I also have my lab containers, my vacuum containers here. That's going to collect my samples here, and then I have my transfer device as well. Okay, I have my order of filling tubes right here, alcohol swabs, gloves, tape, hand sanitizer. Alright, so now that I have everything that I need, I can go in and meet my patient. Good morning, Jennifer. My name is Adam. I'll be your student nurse today. We had an order here to collect some blood for labs here. We have a CBC, a complete blood count, and a basic metabolic panel, which is electrolyte count. Do you know what these are? And she says that she does. Alright, so I'm going to give us a little bit of privacy here. Jennifer, could you give me your full name and date of birth, please? She tells me 11/5/1975. And so I'm going to check out on her hand here, and that checks out. So that looks good. Alright, so I'd be assessing her, also asking if, making sure that she is able to follow commands during this as well. She's able to follow commands. Okay. So I see on here with my order of filling tubes, I'm going to want to do red first, then mint. Okay. So I'm going to be doing this off of a central line. Here she has three lumens here. So we're going to use the one that the facility wants for drawing blood. Here in this case will be our white here. We are going to you want to make sure that you have 4 French or greater. Make sure that 2 is big enough. If they had some IV solutions hooked up, you'd want to pause it for 2 minutes so that we can draw. If it's life-sustaining medication, fluids, you would obviously want to keep that running. If there is TPN on there, you do not want to use a line that's with TPN unless it's your only access. So that is another consideration with that. Alright, so here we're also going to look at our site before we pull anything out and look for any redness or any sort of infection, any sort of infiltration, any swelling and stuff. Everything looks really good here. So here I have my everything that I need here. So first things first, we're going to flush. We're going to make sure though that we have no air in here. We don't inject air into our patient. So this looks great. This one definitely has some air. There we go. Good. Okay. This looks empty. There we go. Okay, so here, sometimes their facilities will use what's called a CHG impregnated cap. You would obviously want to remove that. At the end, you'll want to replace it, but since we don't, we're going to use alcohol swabs. That's what our facility wants, 15 to 30 seconds. So here we're going to clean. Okay, we're going to unclamp. Okay. Attach our first normal saline flush here. So what we're going to do with the first one, nice and slow. Okay, after we have all 10 in, we're going to aspirate the 10 mils back out, okay? So, okay, we're going to remove, reclamp. I'll throw this away wherever your facility wants to dispose of, because it's going to have blood in it. Dispose of, you know, wherever the appropriate, you know, disposal is for that. Next, we're going to, this is where we're going to collect our blood. So we have our empty 10 mil and clean. 10 to 30 seconds. We're going to unclamp. Okay, so here is going to draw out. So some considerations here. You only want to pull out as much blood as you need. If your blood draw asks for more than 10 mils, you're bringing more than one syringe. If you only need 10 mils, then only get 10 mils. A lifespan consideration would be if you're on a peds patient and you only take what you need, because you only have so much blood, so you can cause complications by taking out too much blood, especially when it's not needed. Okay, so here, now that we have what we have, we'll reclamp again. And take this off. So here's our blood. So what we're going to do now is that we're going to collect our blood. So here we're going to connect. Stays. And then our order again, it's red then green, or mint. So here I'm going to insert, take what we need. It's about right here. Okay. Remove, you're going to rotate like this. Okay, you're going to set that aside. You're going to, this was full of air, I had to take that off. Okay, so here we're going to insert our next. Take the rest of what we have, the other half. Okay. Yeah. So, all right, rotate. So here we're going to want to label here. We're going to initials, date and time, not to make sure that we cover up our label of what we had just collected, what for. Okay, so after getting our labels on, we're going to compare with our patient to make sure that we have the name, date of birth, and it matches up. Name and date of birth matches up. Very good. So these are going to go inside a biohazard bag, and also I'll be attaching the requisition form that goes with it. Make sure that we have, the form filled out with what we need. Okay, so we're going to set that aside. So what we do next here is that we're going to finish flushing our central line. So clean, 10 to 30 seconds, alcohol swab, attach, without a cap, unclamp, good. Okay, then we have that last flush here. Same thing, nice and slow. If this wasn't a pick, we would be pulsating these last ones. It looks like this, but we wouldn't be doing this for our central line here. Okay, so when we're done here, we're going to reclamp. And then here, you would put in your heparin. If you'd clean again, put in your heparin here if your facility wants you to do that. Here we actually don't have to use it. Here we would put on that CHG impregnated cap if your facility requires it, which we don't. So there's that. So I'll collect all this, and then we will clean up my area. I'll take off my gloves, clean my hands, check in with my patients, see how they're doing. Jennifer's doing great, she says. We're gonna ensure safety, low bed floor mat, call light within reach, and we're going to, arm rails up. I'm gonna clean up my area, dispose of my sharps inside the sharps container, maybe any, that syringe that we did earlier with blood, you'd wanna throw that in there as well. And then I would be documenting obviously an assessment of my site, I think, which is important. We had everything that we needed for our lab. We also would I already said lifespan consideration. So we would continue our fluids again as ordered, and this concludes my video.